tell us what the biggest issue is that you're concerned about in this budget?
They zeroed out the lead mitigation line out of the Ohio Department of Health from $7 million a year, so $14 million total to zero. And the lead safe home program, it literally went to $250,000 a year. Why is that crazy? Because as a lead poison survivor out of Cleveland, Ohio, there are so many young people and families who are living and drinking with tainted water all across the state. We have an infrastructure problem in Ohio. In fact, Cleveland, 90% of the homes were built before 1978. And so when we think about the quality of water and how it impacts someone's neurological, cognitive abilities, and then how that then ends up impacting people's ability to be educated, how they get to work, whether or not they can succeed, right? It is a domino effect, and the root cause is the lack of infrastructure. And so zeroing out this fund means that we're likely going to see more families drinking tainted water. And so it is something that I want to call attention. It doesn't probably rise to the surface of headlines. There's a lot of other things that my colleagues are going to talk about that does. But when we talk about the quality of life for Ohioans, the fact that we can't even know whether the water coming out our faucet truly is the cleanest it can be is a problem for all of us to be aware of. Thank you all.
As a budget researcher, I think a lot about not only how the state raises its money, but how federal dollars interact with our state budget. And it's a lot. Certain programs are very, very influenced by federal dollars. And so what's happening in Washington, D.C. right now with the federal cuts will impact Ohioans and their ability to get access to really important programs.
1 out of 5 women rely on Medicaid for their prenatal care. 1 out of 4 nationally rely on Medicaid, and our nursing homes rely on Medicaid. 60% of the money that goes to nursing homes comes from Medicaid. If we see the federal cuts that are projected to happen, it will influence Ohio to the tune of about $3 billion and will force rural hospitals to close, which has already happened. We have maternity deserts. We see people coming from all over Ohio for prenatal care, and it will force physicians to leave the state. Work requirements are their excuse for cutting Medicaid. But let me tell you from my experience, people are working 2 and 3 jobs.
Come on, say that.
Because of corporate welfare and the fact that companies like Amazon and what other companies do people work for? Walmart. Those are companies that don't give their employees enough hours or make healthcare unaffordable. So those people who are working 2 and 3 jobs, they're working as waitresses, they're working in coffee shops, they're working in retail or in the factories, they cannot afford the healthcare and they rely on Medicaid for healthcare.
And so we have a responsibility to properly fund schools so that way, one, our babies are getting their education, but then also thinking about ways we keep our seniors in their homes. And then finally, the thing that bothers me the most is this failure to really look at child care expansion. Because when you look at the governor's proposed budget, when we talk about child care expansion, they gutted all of that. What he wanted to do was to allow for more people to receive child care. When you look at child care now, Title 20 and all those other things, I was a recipient of Title 20. I have a 12-year-old son, and so I had Title 20, and I know what it did for the least of these, and I know how it helped me. But think about if we were able to expand it, how much we could help more people. If women, if families, if parents don't have access to child care, what's going to happen? They're not going to be in the workforce.
So in the 1990s, when our Ohio Supreme Court said that the way that we were funding our schools was unconstitutional, at that time, the state was paying an average state share of 42%. And the Ohio Supreme Court said that 42% was not enough in order to provide an equitable education across the state of Ohio. We were relying too much on local property taxes to make up the rest when we were only at 42%. In 2025, when the governor proposed his budget, His proposed budget would have had us at 32%.
Oh, yeah.
I mean, it's outrageous to me, and so coming into the budget process, we knew there was going to be a lot of work to be done to get us to where we needed to be. Unfortunately, what the Republican majority did is that they took the very first and bipartisan constitutional funding model that we have, and they tossed it in the shredder. The numbers that are in this budget right now are truly pulled almost out of thin air, and the way that the budget is written, it would prohibit us from relying on that constitutional funding model.
This budget, for some unbeknownst reason, I did not hear this brought up once in any committee hearing around the Ohio Housing Trust Fund. They took, if you ever buy a house or refinance a mortgage, you know those fees that you never really look at what they are, but you just pay them because they say you have to? A little chunk of that goes into the State Housing Trust Fund. That invests in programs to build houses, homeless shelters, put ramps on a senior citizen's house so that grandma can keep living in her house for another 20 years and be an asset to that community instead of having to go off to live in a nursing home, right? Good things that are funded out of this trust fund. For some reason, in the 11th hour of the House budget process, they said, nope, we're going to just take that trust fund funding and send it to the counties to do whatever they want with.
So the budget concerns for me is currently public education. I see the budget as proposed by the House could lead to the end of public schools in the state.
Yeah.
That in combination with what's happening in DC. This budget is giving more money to private school vouchers and taking money away from public schools. The loss of the Fair School Funding Plan, which was a bipartisan effort that was started 4 years ago, was supposed to be phased in over 6 years, and the third phase was supposed to start with this new biennium, and the House budget completely gets rid of that. Communities are taxed out, and the state isn't paying its share to educate the 90% of Ohio students who attend public schools. So we need to stand up for public education.
But the other issue that is compelling to me is this issue about access to affordable housing.
Yeah.
I've traveled this state in the last 6 months, all over the state. Certainly the urban areas, the suburban areas, but also the rural areas, where children and families were sleeping in cars. That's not okay.
No.
And so we have lots of work to do in that space that are hurting families and children. This issue about access to health care, it is serious. And I think the representative has said it very, very clearly. It will have dire implications for many of our families regarding Medicaid. I'm 76 years old. And so for our seniors and for those that have played by the rules, have now retired on fixed incomes, and have to worry about property taxes. I served on the Property Tax Reform Committee. So we have lots of work to do, and we're going to be there and working vigorously.
Two really key critical issues because they will fundamentally, I think, do lasting damage in the state. The first is public education, without a doubt. Sustained attacks, and there are multiple ways that public education is attacked. We need to give more money over to unaccountable, not only through the voucher program, but some of the worst players in the non-public, I don't even know what to call them, non-public, non-charter, schools. So there's so much bad being done in public education that we're pushing back on. The other big piece, and we've heard it in the national news over the last week in particular as Congress has been debating this issue, is Medicaid and Medicaid expansion specifically. Just in the House version of the budget, a $3.4 billion hole in the $billion hole in the state's Medicaid budget, which goes across the board. All of those who get care through Medicaid, including those with disabilities or seniors, etc. Close to 8,770,000 Ohioans will lose their health care coverage overnight. And here's the thing that I remind folks, and I'm sure Rep. Somani especially probably already said this, that I remind folks about Medicaid. While you yourself may not have Medicaid, the fact that we have Medicaid expansion in the state of Ohio is so important. in keeping many of our provider doors, our hospital doors open. Because prior to Medicaid expansion in the state, the number of uninsured that we had in uncompensated care, guess what? That care still is needed, and we often see it in our emergency rooms, but it's not compensated. And so who pays for that? Well, either you, as someone with private insurance or other insurance, you make up for it through the rates that you now get charged, or the providers can't keep their doors open. And so we have, especially behavioral health providers, many of our rural hospitals that are delivering key services, they have to close their doors. And so we are going to have many communities. This impacts every single county across the state, many communities that if we lose Medicaid expansion in the state or have drastic cuts to Medicaid, that means that these places are no longer going to be able to operate, and that impacts every single one of us.
Given that the Democrats have been unable to stop this stuff so far, could you guys outline some concrete steps that you plan to take?
And then we had the Civil Rights Act of 1964, the Voting Rights Act of 1965, and the Fair Housing Act of 1968. How did they get it done? By people organizing and coming together. We're there again. Because as elected officials, because we got to get the numbers, because right now in the House, the numbers, they can have a
34.
Right. They have a supermajority in the House. They have a supermajority in the Senate. We come to work every day saying, yeah, you got the numbers, but we got the plan. So we're gonna, we got to continue to work with you all. We cannot do this work without you. People come down, hundreds of people come down to give testimony. We're in the battle right now of our lives.
As you connected with Indivisible, this group here was just phenomenal organization. I mean, here's my concern about when we build all of our faith and trust into one singular person and personality, then the party becomes a cult of a personality. And we see that happening right now with Donald Trump and the Republican Party. Yeah. And we are not that. That is not who we are as Democrats. Number one, we're way too diverse within our party. We are a Big Tent party, and that means we got a lot of different ideas and a lot of different people who are leaders within the party. And it's part of the struggles that we have because of what our values are.
And so to your question earlier about what we're going to do differently, we have to talk about the values, what we believe Ohio can be versus what they believe Ohio can be. And that distinction alone, if you believe that every single rural Ohioan deserves to have the affordable health care access, and my colleagues do not, we need to speak truth to power. If you believe that every single community should have seniors staying in their homes because of property taxes that are affordable, and my colleagues want to shift the burden more on homeowners, particularly our most vulnerable seniors, we need to talk about it, right? But we can't do the value work alone. We have to do it collectively. That's the only way that I truly think that and believe that we can save Ohio. Thank you.
Part of the biggest issue right now is gerrymandered districts.
Oh, that's right.
Because politicians are choosing their voters. And I think we tried to do fair districts, but because of the fact that we've had Republican power for so long, ballot language was changed. People were confused.
Yeah.
And they ended up voting against their interests because most people want fair districts.
But the people I felt 20 years ago were working toward similar goals. I don't see that as the case anymore. I now see people who say, I don't care that there are children who are hungry. I don't care about housing people in other communities. I only care about who I care about. And I will be blunt, as a leader in the Lutheran Church, I will place the blame for this on Christian nationalism. Because Christian nationalism says who is in and who is out, and gives us justification to say these people are unworthy of being in our community. They're unworthy of food, they're unworthy of good education, they don't belong. And we can look at Islamophobia, anti-Semitism, transphobia, anti-LGBTQ youth, homophobia, all these things that we see on the rise in our communities right now can go back to this. And I see Christian nationalism and white supremacy and toxic masculinity as diseases. And the reality is, where do they grow? They grow and expand when there's fear and anxiety in our communities.
I don't want you to feel powerless, and I don't want you to feel hopeless. Because when you think about, because we always got to talk about the governor's proposed budget, because it always gives context. So when you think about public education, and when you think about the libraries, all of those things in the governor's proposed budget were tremendously cut, okay? And after the finance committee decided to make some compromises, how small, whatever they may have been, they basically flat funded a lot of those things, especially public libraries. The reason why the public libraries even got public or flat funded was because of you all. Yep. Okay? It was your fight. It was you all showing up there. It was you all sending letters. It was you all making calls. It was you all catching them in the hallways. Like, listen, we got to do something about this. This was real organizing.
When you send in those 4 emails that we all put out, edit the subject line. Edit the text of the email. Absolutely edit it. They are throwing them out if they realize they are just getting a form letter sent in. So edit the information. You should be able to, in most form letters that advocacy groups are putting out, edit the content.
Like I said before, I think it's important, explore the organizations that are available to you. A lot of these issues have organizations that have huge lists of action alerts out right now. So if you're a social worker, the National Association of Social Work has a ton of stuff for you. There's the ACLU of Ohio, there's Equality Ohio, Policy Matters Ohio cares a lot about education, there's Honesty for Ohio Education. All of these organizations have huge topic-based lists of things that you can do. I recommend seeking those out in the issue area that you're the most passionate about. Ohio Environmental Council, right? Lots of sustainability issues. And so that might be a way for you to make a targeted change with an organization that really needs your support.
Also, we can help connect you to groups in the state in your area. If you reach out to us, we're happy to do that.
The other thing I would encourage you to do is to please reach out to anyone who you know who lives elsewhere in Ohio. We all live in our bubbles, and we all have relationships outside of those bubbles. Sometimes those conversations aren't comfortable, but they're really important. So I would encourage you to reach out to people that you know outside of Central Ohio and share the things that you know how to do so that they feel comfortable doing them also.
One of the things that the Speaker of the House tried to do was get 60 votes for the budget. If that had happened, it would have been veto-proof. So currently it's not veto-proof. So as the Senate, call the Senate, but more importantly, start calling the governor's office too. Because there are going to be things that he didn't want that are in this budget. So that is another place that you all have the power of calling and speaking on the budget, because it is a harmful budget.
Instead, call the governor's office, call every member of the finance committee. I serve on the finance committee. Also call all 33 members of the Senate, because that was important to note. Not everybody lives in Franklin County. Call all 33 members, because we'll all be voting on the budget. And I certainly want to appreciate Indivisible and the tremendous opportunity for us to be here today, to meet with you.
Thank you very much. I'm just going to wrap it up today. Can we give another big hand to all of our panelists?